Good afternoon, folks. It's Robert Chappell, Executive Editor of Madison365 with your daily update for Monday, the 20th of September. I still have the wrong logo on there. There, you can see that one a little better, huh? All right, it is Monday. That means it's Metcalf's Monday. Metcalf's is a fourth generation, family owned and family operated market with stores in Madison at Hilldale and behind Westtown Mall and in Wauwatosa at 68th and State. It's football season. That means it's tailgate season too. Metcalf's local producers have the store stocked up with everything you need to feed a crowd of fans. You can stop by or order for pickup or delivery anytime at shopmetcalfs.com because it's just easier to do and there is still a pandemic. So please do your tailgating outdoors. All right. The news today on the COVID front, on the surface, feels not terrible, but is actually pretty terrible. We know that on Friday, there was some sort of delay in data on Friday that DHS did not report, but Public Health Madison-Dane County did. So we're taking all of the Friday numbers and today's numbers with a tiny grain of salt, that they might be a little bit low. I hope that's not the case, because if these numbers are low, we're in trouble. We're reporting 1,518 new cases today. Now, we've had over the past, last week, there were several days where we had over 3,000 cases. So 1,500 seems not too high. Problem is, that's 1,500 on a Sunday, right? Throughout this entire surge, we've been seeing a pretty recognizable pattern because the state is not doing data on weekends anymore the way they were a year ago. So our Mondays have been like 300, 400 cases, which have been reported from Sunday. So to have just the Monday numbers continue to rise, and we had like 900, then we had 700, now we have 1,518 new cases on a Monday. That's a big red flag for me that this is going to be a rough week. Like, we might be over 3,000 again the rest of the week. Cross your fingers. I hope that's not the case. The positive test rate also was supposedly 7.4. It was reported at 7.4 on Friday. Now they're saying Friday was 8.2. Today it's 8.1. So it's still higher than it was supposed to have been last week. That's the percentage of all the tests in the past 7 days that have come back positive is 8.1%. That percentage is supposed to be 3 or less. So to be basically above, to be in this range of 7 to 8 for the past almost 2 months now. Like we hit 7% at the end of July. So to be just stuck there at between 7 and 8% for 2 months is really, really bad, because it means two things. First of all, we have lots of disease spreading, but also we have not enough testing happening. The more testing you do, the more negative tests you'll get, and that percent positive test rate will go down, which feels like artificial, but it's not, because then you have more testing, more surveillance. You're going to catch more cases. You're going to isolate more people so it doesn't spread anymore, right? Now, the only this is a good news. This is another grain of salt. Good news. The reported death rate has dropped to 11 per day. As of Friday, that was 13. We only report 2 confirmed deaths on Sunday, yesterday. So that death average has come down slightly, but again, that's a lagging indicator, right? Those aren't deaths that happened on Sunday; they were just reported on Sunday. So you want to look at that 7-day average, and you want to take it out with a grain of salt, understanding that these are deaths that happened 3 to 6 weeks ago. That's how long it takes to get them reported. And these are deaths that result from cases that were identified, 4 to 6 weeks before that. So, the other piece of news, Pranisha, that's a great question. I'll get to it in just a second. The other piece of news that's not as terrible is hospitalizations. We are now at 1,099 people hospitalized. That's 9 more than yesterday and about 43 more than a week ago. So while the hospitalization count continues to rise, it does not rise as sharply as the number of cases, nor as sharply as the hospitalization rose earlier this year. In July and August, it was going up a lot. It was going up 10 to 12% every day. Now it's not even, it's like 1% each day. So while it continues to rise, and that continues to be a problem, it's rising much more slowly than other numbers. Also, we have capacity issues, obviously. We're getting close to that point where hospitals are going to have significant capacity problems, not only from a perspective of beds, but from a perspective of staff that has been in the trenches of this for a year and a half now. And, it's going to, capacity is going to be impacted. Right. So Pranisha asks, are they separating out K-12 cases? Is this a factor in the uptick? No, not really. They're not. It's for whatever reason. I mean, it's a little bit hard to get that data. They do have some data. Oops, let's see if I can find it here. They have some data in terms of age, but what they don't, what the state is not reporting, is clusters. They're not doing a lot because they honestly don't know where people are getting it. So to here, let me share. Let me show you this. I'm going to move this over here, and I'm going to share this screen with you. I don't know how well you can see this, especially if you're looking on a phone. But this is by age group. The green here is oh, I can't even see it. The green is 16, 14 to 17. The yellow is 9 to 13. The red is 3 to 8, and the blue is 0 to 3. So you can see those are all rising. These are at the top graph here is weekly. So you can see like how all of these youth age groups, except the littlest kids, have really spiked just the same as everybody else. And this is the cumulative total down here at the bottom. So you see that there is increasing among school age kids the same way as it's basically the same way that it's increasing with the general population. But what the state is not able to report, and I see your other questions, Peggy and Amber, I'll get to those in just a minute. Thank you for those questions. What the state is not able to report is whether or not these kids caught it at school or whether it's spreading at schools. Localities, however, are reporting that, and every school district has its own, or not every, but many school districts have their own data dashboards, and it's really hard and time intensive to like check all of those to try to give you a good picture. But also Public Health Madison-Dane County, in its weekly snapshots, do report clusters, and they report in the last one from last Thursday, which includes data from the week before that, so earlier in September. I want to say there were about 30 cases connected to schools and daycare centers, so which is not, it's not huge. It's not as huge as I would fear, but again, that was data from like 2 weeks ago. So we'll wait and see this Thursday what they come out. It doesn't seem to me to basically answer your question, Pranisha. It doesn't look to me that kids are really driving the surge. I think kids are part of the surge, just like every other age group is part of the surge, because kids are not vaccinated, so they are part of it. They're more a part of the surge now than they were a year ago because they're, first of all, not vaccinated, and secondly, back at school. I don't think it's kids driving the surge, though. I don't think. That's the way I look at the data. Peggy asks, are they tracking how many hospital cases are breakthrough from those already vaccinated? Yes, they are. In fact, I can show you something else from the state, if you don't mind, if you'll indulge me, another visualization. I talked to this last week Wednesday because, and I know a lot of you don't, you're not watching every day. I know that, so I don't mind sharing this again. I got to find it though. But they're reporting this on a monthly basis, once a month. They started this in August, so this is only the second time they've done it. But they're reporting statewide the cases, hospitalizations, and deaths among vaccinated versus unvaccinated populations. And I will show you this graphic if I can remember how to share it. There we go. This is just the month of August. These blue little people here are cases per 100,000. And then these dark blue ones down here are hospitalizations per 100,000, and the black ones are deaths. So you have among vaccinated people, you have 380 cases, 11 and a half hospitalizations, and 1.1 deaths among every 100,000 vaccinated people in the state of Wisconsin. Now we scroll down here to see the not vaccinated cases. 1,413.7 cases, 98.5 hospitalizations, and 11.7 deaths among unvaccinated people. And again, they're going to update that once a month with the previous month's data on the 15th of each month. So basically what it boils down to is if you're not vaccinated during the month of August, just that month, you're 4 times more likely to test positive, 8 times more likely to land in the hospital, and about 11 more times likely to die of COVID if you were not vaccinated. Amber asks about the map. There is, we just don't have the staff to do that every day like we used to, unfortunately. The state provides that data. You can find it yourself. You can find it by census tract on the state website, and we had people to do that last year, and we just don't have the staff to do it this year anymore, unfortunately. And it's kind of, it's just like, it's just everywhere. Anyway, Peggy, this is a great question. And first, and don't worry about asking a repeat question. Because like I said, I know you're not watching, and I'd say something once and then it's gone. And now, so to be asked again to repeat that data is actually really good because the more people are getting that information now. You can find it. I'm going to put a link in the comments. That's the link I just shared in the comments is for the illness after vaccine. Bobby asks, are they tracking how many hospitalized patients are there for or with COVID? How many are for COVID, pneumonia, or on oxygen? Yes. The 1,099 number that I shared is people hospitalized because of COVID. That's not everybody who's hospitalized. I mean, it's a relatively small percentage, actually, of the total number of people who are currently hospitalized. Let me see. And they do have, I just give you that number because that's kind of the, most relevant and easiest to kind of understand. But I can tell you, there are, let's see, 579 people on ventilators. That's all people on ventilators. That's not just COVID patients on ventilators. There are 579 people currently on ventilators. And the reason they count it that way, rather than separating out COVID versus non-COVID people on ventilators, is that Wisconsin Hospital Association, which is where I'm getting this data, their main concern is how many ventilators are currently available, right? So they're not differentiating why is a person ventilated. They're like, how many ventilators do we have available? So that's why they're keeping it that way. The other things that they are keeping track of is the number of hospitals with less than 7 days of PPE on hand. Right now, there are 25 hospitals whose gown supply will not last 7 days. There are 18 hospitals whose mask supply will not last 7 days. And there are 16 hospitals whose N95 masks will not last 7 days. So, there are a handful of hospitals, not a lot, a handful of hospitals are getting low on supplies. That's basically where we stand right now. And that's basically all the data that WHA collects and reports. Appreciate the questions. Very good questions. You guys are on top of it today. I like that. That's the COVID info that I have for you. Again, it's not great news for the most part. I think we're going to be bracing for a rough week in terms of COVID numbers. We are right now at 2 counties, Buffalo and I don't remember the other one, Polk, I think, are at critical levels of COVID spread. 64 are very high, and 6 counties are at high. That's purely just number of cases per 100,000 people. Not a lot of nuance to that number. We are now at 53% fully vaccinated. Slowly but surely getting there. We do hear through the grapevine that authorization of vaccination for children 5 to 11 is coming soon. Sort of November-ish is what a lot of the reporting has been saying. All right, we're going to take a short pause and come back with a couple other news items for you. Don't go away. We will be right back right after I find the... there we go. We'll be back right after this. All right. Thank you for sticking with us. One thing, if you're a podcast person, listen to It's Only 10 Minutes. That's our morning news podcast. We had a discussion today. This is not something I reported on for the website, but the State Journal, or not State Journal, I'm sorry, the Journal Sentinel, the Milwaukee Journal Sentinel, had a piece on Friday laying out how Mandela Barnes, the lieutenant governor, who's now running for the United States Senate, didn't file an income tax return in 2018 and was on Badger Care. The reason he didn't file a tax return is that he didn't have a job. He was running for office. That was his full-time job. And you can't get paid for that. So he didn't have any income to report. So he didn't file a tax return. He's not required to. This is just a state return, by the way. And he was on Badger Care because he didn't have a job. And in this country, as dumb as this is, we tie our healthcare to our jobs. So he bought into Badger Care for that 1 year. And the Journal Sentinel basically is trying to shame him for this, right? And trying to make it sound like he's criticizing people, wealthy people, for not paying enough taxes, but he didn't even file a tax return. Well, those are not the same thing. Like not paying taxes and not filing a return when you don't have any income, those are two totally different things. So we talked about that on the podcast this morning, kind of went over the problems with that angle of reporting. So if you're interested in that, listen to the It's Only 10 Minutes podcast. Also today, Black Oxygen has a new episode out with Letitia Nelson, who's the CEO of Goodman Community Center here in Madison. Give that a listen as well, wherever you get your podcasts, or you go to madison365.org/podcasts for Spotify links to all the shows that we have. In local news today, Darnell Moore, he's the head of inclusion strategy at Netflix, which is a big deal. He's also a best-selling author and a cultural critic and just, all-around leader person. He is one of the keynote speakers at the YWCA Racial Justice Summit coming up on September 28th, 29th, and 30th. He spoke with our editor, Dave Dahmer, so you have a good preview of that and get to know him a little bit, and a preview of what the Racial Justice Summit is going to feel like coming up in Madison. It's going to be mostly virtual. but we'll have a couple of events in Madison as well. Also today, we have the United States Secretary of Education, Miguel Cardona, is on UW-Madison campus today. He's meeting with Latino students. He's getting a tour of the Latino Center and getting a look around campus. He started the day in Eau Claire and toured elementary school there, and he stopped by the Memorial Union and visited the public service fair there and got a tour of the Latino Student Center. He's doing sort of a tour around the country, visiting a bunch of schools and universities, and was in Madison today. In national entertainment news, you might recognize him from his role in the 1995 movie Friday. Anthony A.J. Johnson has died at the age of 55, and no cause of death was shared publicly. But he appeared in, as I said, that memorable performance in the film Friday. He was also in House Party, Menace to Society, Lethal Weapon 3. He was on Martin and Malcolm and Eddie on television. You've probably seen him at some point. And again, gone too soon at the age of 55. All right, that's all the news I have for you today. We appreciate your attention and your time. And if you want to support the work we do, we're always going to be free to you. Like, we don't think people should have to pay for the news, especially important news like pandemic stuff. Like, it's for everybody, and everybody needs it, not just those who can afford it. But it's not free for us to create, right? The journalism is professional. Our journalists are professionals. We pay them. Not a lot of overhead. We don't have an office or anything. We don't pay rent at our office, or so there's not a lot of overhead. Any money we bring in pretty much gets invested right back into the journalism. So if you want to support us, if you could pay a monthly subscription, we have an opportunity to do that. Just go to Madison365.org/thefam and join the fam at whatever level works for you. $5, $10, $25 a month. Pick your own amount, make a one-time donation. It's all tax deductible. We're a legit 501c3 nonprofit newsroom. So do that if you can. If you come here every day looking for the latest on the pandemic, it's obviously worth something to you. So help us keep it free for those who can't afford the $5 a month or whatever. Right? All right, that's all I have for you. Appreciate your time. Have a wonderful evening. We'll be right back here tomorrow at the same time. Talk to you then.
This is 365 Media.